Dickens, the host of Dope Black Therapist. Please like and subscribe this video and share it. I am with the phenomenal Miss Melodye Watson. I'm going to get all her credentials right because this sister is acclaimed, highly qualified. She LCSW. She has an agency called Pure Potential Unlimited. She is certified in psychedelic assisted therapy and she specializes in trauma. So welcome, my sister.
Thank you. And don't forget that LCSW-C at the end because I'm also a
You
supervisor.
earned that seat. Hello. Hello.
Yeah.
Exactly. Exactly. So, all those social workers out there, please give us some love. Put it in the chat. We have a lot of people who tuned in tonight. So, let's get
Awesome.
right to it.
Great.
What is psychedelic therapy or medicine? What is that?
Okay. So, psychedelic assisted psychotherapy is the use of a psychedelic substance like, let's say, LSD, MDMA, or psilocybin mushrooms that is being used to support someone who is maybe dealing with treatment resistant depression or some other mood disorder, post traumatic stress disorder. And you're taking the substance and then integrating that process, right? Like what comes up for you with someone who has been trained and can support you in that integration process. And that basically means how you're making meaning of the experience, right? And so that's it in a nutshell. And, I'm so excited to share this with you because, I wasn't always doing this work, right? And in fact, I'm still very new to it, right? But it just fascinates me. It really actually encourages me in terms of it being a treatment modality for people who feel like maybe just traditional talk therapy hasn't helped or worked, or other types of medicines that they were taking haven't really been that effective. And so this just opens up, a new pathway for wellness and help for people.
Absolutely. So, let's get the negative stuff out the way. I can remember growing up and hearing
Mhm.
people trip on LSD thinking it was the bad drug. And
Mhm.
now it's back. And I remember first hearing about it as a treatment modality with Will Smith. Him talking
Mm.
about going into the mountains and using psychedelics in order to have a spiritual experience. Tell us the history. Is it a bad thing for people? And how why is it coming so popular now? What is the
Oh,
history of it?
wow. Okay. So let me just answer that question. Is it a bad thing for people? Like, the topic says, is it really worth the trip? And I'm going to say maybe, and it depends, right? Because there are several different medicines out there. So I like to, start maybe talking about the history from the perspective of psychedelics that are entheogens or plant-based medicines, right? So, this would be like your psilocybin mushrooms. This might be medicine that is coming maybe from the frog, right? This might be ayahuasca. So those types of psychedelics that are, you know, plant-based and have been around for thousands of years, right? And people have been interacting with them for just as long, right? So, if we consider, let's say, iboga, which comes from West Central West Africa and is used in the Bwiti tradition as an initiation ritual. And they have found that medicine to be very potent and effective in helping people deal with addictions, right? And so, in that regard, is that bad? No, I mean, because look at how we've suffered due to the opioid crisis in this country. And here there's this medicine coming from a root, coming from a plant in Central West Africa that can support people in getting off of, heroin and other types of opiates. And so in that regard, is it bad? I don't think so. But I also think that, you know, from a historical lens, making certain psychedelics or plant-based medicines that have a psychoactive component to them criminal really, comes more recently, right? Comes, out of
Yeah.
maybe like the counterculture that was happening in the 60s and 70s, and, moving to a more conservative political climate, and these substances become Schedule 1 drugs, and, research that was happening like in the 50s, and even well beyond before that, that was showing like, oh, look, here we have synthesized a substance like LSD, and we're finding that like there's some benefits to it, and we're, researching it, and maybe having a psycholytic approach in how we're using it, and all of a sudden that gets shut down, right?
Mm.
Because, like, oh, this is bad because, some people tripped and maybe didn't have a great experience, and others felt like, okay, they should demonize it, maybe for political reasons. And all the research and activity was cut off for about 40 years, right? But
Wow.
then more recently, there's been so much advocacy through organizations like MAPS that, have been quite instrumental in helping these substances get what we would call like breakthrough therapy status through the FDA, so that we could start the research again and really figure out like, okay, how are these substances helping people? Like, how can we use it as a, novel mental health treatment for a range of issues that people are experiencing? So,
Awesome. One of the things that occurred to me when you were speaking is something I think I
mhm,
heard before, about how there's a movement for having more natural treatment modalities. And you
mhm,
said it's plant-based, so there's nothing more natural than that. And I think that this movement might be in tandem with the push for marijuana to be seen as something that has medicinal purposes. I
yeah,
remember,
absolutely.
yeah, and I remember a
Yeah.
while ago watching this thing on the FBI, and they had said that there were certain things that certain groups were targeted, like MLK was targeted, the Black Panther was targeted,
Mhm,
and on that list, LSD was targeted. And there was a narrative, just like there was a narrative about Martin Luther King being a disruptor, an interceptor, or Malcolm
mhm.
X. But LSD was also, I heard, put on that list, and there was a narrative which caused it to go away, would be banned. But it was actually a very safe drug. One or two people tripped, but it was really safe. But it's interesting because around that time that it disappeared, where there were a lot of narratives where people, didn't want people to follow certain leaders and to use something that was more natural. You know,
Right,
yeah,
right.
yeah.
Well, to be clear, so LSD um, is a derivative of actually a fungus, right? That grows on certain grains. So it's like ergot. And forgive me for not being able to like pronounce like the whole LSD acronym, but it was synthesized, right? And way back in the day, like synthesized by a European guy who, was working on it in his lab, took it, rode his bicycle home, and was like, oh, something is happening here, right? Like I'm experiencing my world in a different way. And I like it, right? Or I need to further explore. And so, that kind of set off, right? Like other, researchers and scientists into looking at like, okay, what else might this derivative, of this fungus do in terms of being a medicine, right? Um, you know, in terms of it being, classic psychedelics. So maybe I should spend a little time just talking about that, just, for those that are listening in, and may have, just curiosity about like, well, what are you even talking about when you're talking about psychedelics, right? Because, is it just LSD? No. So, from my perspective and what I've learned, right? So we've got mescaline, which is derived from the cactus, so definitely plant based. Psilocybin coming from the mushrooms, DMT, which is coming from ayahuasca, and then LSD. There are other types of psychedelics, but really like those four considered, the classics, right? There's MDMA, which, we might know of that as ecstasy and a party drug. Um,
Hmm.
but like the research has proven like, okay, this is a kind of psychedelic or entheogen that really helps people to open up, to be able to access maybe some painful pain points in their life that have been traumatizing, and help them to work through it, right? And it's done under, a process, right? Where the individual is prepared, they have the medicine while they're sitting with someone who understands what may come up for them, is allowing for the substance to work through them in a way that it is kind of unleashing their what do we call it, inner healing intelligence. There's what is it, 5-MeO DMT, which, short acting, but like really kind of like, let's call it the God molecule, because you'll, just have such a expansive experience, and the list goes on. I mean, I believe that there are so many plant-based psychedelics, as well as those that have been, synthesized through different molecules that, natural or synthetic, are, working to alter our consciousness in ways that are similar to those psychedelics, classic psychedelics. And so I think there's just so much emerging information out there about it. So I just wanted to kind of share that so folks will know, like, what are we really talking about when we say psychedelics? Because there's LSD for sure, but there's also so many others.
Yeah.
I didn't mention ketamine, right? Because it's not a classic psychedelic. However, it's FDA approved right now, and there's so many clinics that are opening and closing, right, that are offering that as a treatment modality for, refractory depression, other types of mood disorders. And so, again, emerging, right?
Wow. How is it administered? I think you mentioned something about people get prepared for it. How is ketamine administered and how are the others administered? What is that whole
Okay.
process like?
So that's a great question, especially with ketamine, because there's just several routes of administration, right? So there are ketamine clinics today where you can go in for like a 40-minute appointment and get a IV infusion of ketamine, and and go about your day, right? Um, that's not something I prefer, but I know that is, helping some people, right? There is
Are
more of
medical
a
providers doing that or the therapist is doing that? Who's doing the
So it's not like, just going to get a ketamine IV infusion is not like ketamine assisted psychotherapy, where, there's been preparation and the individual has maybe sat down with the provider, and, they've talked about like, well, what's going to happen and why do you need to do this? And you've been assessed to determine if you're even, appropriate for the medicine, right? And, if you have the right diagnosis, so to speak. Then there is, one route of administration where it is intramuscular. There's oral, there's nasal spray, there's lozenges, right? And so, we could talk probably for more than an hour about all the ways in which you can, take ketamine, and like how bioavailable that oral route of administration is, and what it's doing in your body. It's different in the sense that, it's working in the cortex of the brain on the glutamate system, right? So like really helping to create new connections, neural connections, in a way that, like, when we are depressed, those connections are disconnected. We're not feeling as connected to ourselves and our lives. And sometimes ketamine can help support, those connections happening. But, it's important, at least from my perspective, that you would then, make meaning of that process, right? So let's say I'll speak to my own experience, right? Of, having ketamine during a training on ketamine assisted psychotherapy, and sitting with another person, to kind of be there with me, because, I just don't know what it's going to do. Like, what if I need help, right? Like, what if I need, a trip sitter, basically? And, afterwards, like coming out of the medicine, having someone there that I can talk to about that experience and what it meant to me. That's part of, my integration of the experience. And that's helpful in so many ways, especially if, some content comes up during my trip or my experience or journey that I need somebody else there. I need that alliance to really, help process it. So, yeah.
Did you feel lighter after you took the ketamine? Did you feel lighter, more euphoric? Did it make
Mm,
you feel, was it happier? Because I know you said it's used for depression. Did you
mm.
notice anything when you took it, or?
Oh, absolutely. I mean, like, I definitely felt, and again, personal experience, everyone will have, their unique experience. So, but I definitely felt like I was, how can I explain this? Like, I felt like I was worked on, basically, right? Like, my experience was such that, I was witnessing myself on an assembly line, so to speak, and different parts of me were being worked on, right? And
Oh, wow.
I'll be honest, Candice, I'm still processing some of that today, right? Like the different parts that were worked on and the images that came up in terms of, the beings that were working on me, some of them were family members and some of them were more like
Oh, wow.
the best way I can describe it are they were like feelings. And so like I said, it's helpful to have someone who, understands that, and can help you make meaning of it. Sometimes, there aren't even words, right? And so your integration process of, whether it's ketamine or some other psychedelic can involve a range of, modalities. There are some therapists that might bring in internal family systems, to help you figure out those parts. There are some that might use accept ACT or, obviously CBT or cognitive behavioral therapy. But then, there's more somatic approaches to integration where you may want movement and you may need to be creative or expressive with music and art. And so, there's just so much you can bring into that process in order to get what you need out
So
of it.
you're an active participant. So when you're taking the ketamine or any other psychedelic, you're actually conscious, and you
No,
can.
no. So, you're definitely, it's a dissociative. So you're definitely kind of out, right? I know, in the way in which I received it, I was inward. I was inward, but coming out of it, it's like afterwards, what I do to make meaning of that experience and integrate it.
Yeah, and you said that you're still processing. So the experience doesn't stop when you become conscious,
Mm-mm.
that it continues. And I'm wondering if that's why it works with depression, because it continues to help you feel better and
Mhm.
help you deal with things that you don't normally deal with. Is that?
Well, it's like this. So as you consider what comes up for you, right? The integration is really helping you to understand it, right? So then you're, working with your therapist or your guide to really talk about like, well, this is what came up and this is what it means to me. And I might choose to, express what came up through art or, just talking with my therapist about it. And so it's, one of those things where no, you may not be feeling the actual like, this altered state, right? But you're going to be thinking about and maybe even at times, having memories of that experience and needing to really process, right? And like I said, it's helpful to do that with someone who has some training or some understanding and experience. There's been a lot out there, where there's been harm caused because, maybe there's a concept I'd like to explain, set and setting when you're doing this kind of work where, the mindset, wasn't considered and discussed, and then the setting might not have been appropriate or helpful. There's been situations and it's been in media where people have been harmed and abused because someone took advantage of that individual while they were in their medicine in that altered state and really caused great harm. So it's very important that anyone who is choosing this route for supporting themselves really know what they're getting into, understand, through the preparation, like who is supporting them, in the ways in which they'll be supported, and if the space or the container, so to speak, is safe and right for them. So that's why that preparation work is so important, because you'll be discussing, just what does this medicine do to my body and my brain? And, like, are there some physical conditions that I may have that, make it inappropriate for me to take certain type of medicine? What's going to be the right dosage for me? Because for some of them, weight matters, and, all of that kind of thing. So,
Wow.
there's the opportunity to discuss what kind of music you want played, while you're
Mhm.
sitting with the
So
medicine.
it really is very
Yeah.
inclusive of the client
Hmm.
in the whole, if it's done the right way, with the sitter
Yes.
being there, talking about music, all of those things. So it
Mhm.
creates a sense of safety.
Yeah, safety is super important, because during the preparation, going back to, like, not causing harm, you need to discuss touch, right? Someone may be coming, with an experience of PTSD because they've been physically harmed, and touch might not be appropriate for them. So, you really need to be able to, talk to them about that beforehand and really understand, like, if they're, reaching out, does that mean while they're in their medicine, does that mean you go in and hug them? No, like, maybe it means you just offer a light pat, or, something that offers reassurance. Um, that's why, again, I go back to, like, the preparation, the set and setting is so important,
Yeah.
for individuals who will choose this, and whomever is sitting, guiding, and, offering the therapy needs to be very mindful and understanding of that, as they go into this process.
Yeah, absolutely. How long does the whole process take from the
Uh,
preparation? Is that like a separate visit? Is a preparation visit?
mm.
And is there the administrator's a second visit, or is it all in one experience?
So it really varies, right? So let us say we're working with someone who, has PTSD, and let's say miraculously FDA has approved the use of MDMA to, support them, right? Because again, not all of these are, approved for use yet, but in the research, there's been so much done, around MDMA and PTSD. So there's going to be several preparatory sessions, right? Before you even, get to the medicine, right? And then there will be the medicine sessions, and you're taking, a substantial dose of the MDMA, and you could be in that experience for quite some time, in the protocols and research or clinical trials that have happened, an individual, doing this might, have a 6 to 8 hour experience maybe. And we'll need to, have two therapists there with them. And
Wow.
following that, there's integration work. And there may be several medicine sessions, right? 2 to 3. And then, weeks worth of integration work. So it is a lengthy process. This is a treatment. This isn't really a one and done kind of scenario.
Yeah.
If we go to, let's say, ketamine, let's go back to ketamine. And if there was someone who unfortunately is suicidal, and, they may go for 2 to 3 sessions, right? Um, to be able to kind of feel more in control, and be able to kind of come back into a space where they're not wanting to harm themselves. And so a lot depends on the medicine. One of the things that I've had the, opportunity to do is offer peer support to people, who are, using psychedelics in whatever way they choose, right? And may not, have someone to talk to about it or sit with them. And, there's a place that they can go to, or call rather, and just get reassurance. And that could be as short as like 45 minutes, so it
Right.
really varies.
Yeah. Can you
Yeah.
talk a little bit more about how this is treated, used with trauma? Because I keep hearing about how this is a wonderful modality to use with anxious clients, clients who have post traumatic stress disorder or any acute
Mhm.
disorder. Can you talk more about that?
Sure, sure. So, you really want to think about like how are these substances working in the brain and in the body, right? Like we're still learning a lot, but from what I have learned, like a substance like MDMA for helping someone who has post traumatic stress disorder is really working on those serotonin receptors, right? And it's kind of allowing them to open up to access that difficult traumatic event, right? And it's also done in a way where because there's been preparation, right? They can do it in a safe way. And so it's again, it's kind of lowering inhibitions that would may have like locked them up, so to speak, before, where being able to access it in a safe way with the help of the medicine gives them an opportunity to really process it so that they can move through it, right? Without, maybe using one of their defense mechanisms and shutting it down, so that they are still stuck in that traumatic event and that trauma is still in their body. So, I mean, and as as a trauma therapist, understand like
Yeah.
when trauma is stuck in the body, because, it's just too difficult to deal with, right? Like in
Yeah.
our brains, they call it the default mode network, right? It just gives us that ability to kind of get in there and figure it out, right? And you were doing this with the safety of someone who's been trained to guide you and offer you, therapy for it. So yeah.
That sounds wonderful. I know I do EMDR and brain spotting. I know that sometimes people will say, just bring up the memory is too much for them. So we've got
Mhm.
to prepare them for that. But what I keep hearing about this is that it allows them to bring up the memory without that avoidance
That
or that
jolt to the
shock
body.
or fright or that pain. So they're like
Hmm.
watching the memory or experiencing it without that trauma with it.
Yes,
Yeah,
absolutely.
yeah,
Absolutely.
that's powerful. That's powerful. And have you had a lot of clients that you've seen do better with this? Com-
So I've had some. So how I function right now, if say for instance someone is supporting themselves, with psychedelics, I can support them with integration, right? In terms of like helping them to make meaning, helping them to really process what their experience was. So, and I have had quite a few that said that like maybe before I wasn't even able to like really talk about these things, and now I'm able to talk about them in a way that doesn't shut me down, doesn't get me kind of back into that stuck space. I've had others who, maybe their experience with the medicine wasn't what they thought it would be, right? And depending on how they access their medicine, because keep in mind these are not legal substances in most cases, right? And so, I'm not allowed to, help them access any of the medicine. I am not, allowed to, really say, like, okay, I can take you from start to finish with this and sit with you just yet. For ketamine, yes. For some of the other substances, no. So, if someone has come to me, and they were dealing with depression and decided on their own accord to support themselves with the medicine, then I'm really working with them in the capacity of like, the diagnosis of depression. And then there's this understanding that, okay, well, they did this other thing, right? And this is what came up for them as it related to their depression. And I can, help them in that regards.
Oh, wow. So they could come to you or any clinician and they could either administer themselves and have a safe sitter with them and then have the experience and allow you to help them process it for meaning or for
Hmm.
understanding. Okay.
Particularly with ketamine, yes,
Particularly
right?
with
Because
ketamine.
there are companies right now operating where you can you know buy lozenges through them or get a prescription for it, and you take your lozenge and then you have your session with your therapist, and go through with them like what has come up for you. So um,
Mm,
I don't want to give any plugs to those companies. They're easily Googleable. But
Yeah. Yeah.
yeah, so there is that. And then there are clinics that, like I said, some are, they're opening daily, they're shutting down too, but there are also clinics that, you can work with them from preparation through the medicine, through integration. And yeah, I think, it's not just anyone either. Like it has to be, in my opinion, like someone who, knows what these substances are doing in the brain and the body, right? Or
Yeah.
has some understanding of it, and who, has some training in being able to, offer a treatment modality such as ACT, IFS, afterwards, right? Now, as you know, there's a whole underground scene of this where, folks will, human beings are going to do what they want to do,
Mm-hmm.
right? And they may not have the resources to pay for a therapist to help them, or they just may prefer to, work with someone who is a guide, and hopefully that guide, has an understanding, and is well informed of, what the medicine can do, what it can bring up, and how to help someone process their experience. Because, when you ask is if it's worth the trip, if someone's had a bad trip, right, and they've gone to someone who is inexperienced, you're setting them up for more harm, and we don't want to do that.
Mm-hmm.
We don't want to do that. Like we're just now getting to a point in this field where it's like, yes, now we can explore how these medicines work,
Yeah.
and test them, and you know any kind of setback can happen when we have a lot of folks out there who are like claiming to be able to do this, that, and the other, and really don't have, some kind of experience in supporting others, right?
Yeah.
Yeah.
It's beautiful that the indigenous medicine's coming back. It makes me think about the shaman and some other spiritual people who are guides and
Hmm.
really do know what they're doing. I remember seeing on 2020 there that if you have certain medical conditions, this is not good for you. I think the
Hmm.
person had taken Ikawasha, am I saying it correctly?
Ayahuasca.
Ayahuasca, and I think they had a heart
Hmm.
issue. There was something, but they were saying
Hmm.
that he didn't tell them what was happening with him medically before this, and it had
Yeah.
an adverse effect. So, are there any medical conditions that I know the heart? There was a heart. Tell me about heart disease.
Yeah, absolutely. Like if you have like uncontrolled high blood pressure, you might want to really consult with your medical doctor before you engage in some of these substances, right? The way in which, our genetics are set up. So I'll just say, like, for some people of color, right, and the way in which our livers will process certain substances, it might last a little longer, right? Or, may not synthesize in the same way as someone else. And so it's important to know that going in. You mentioned ayahuasca, and then the traditions in South America, like Peru, and those places where the vine and root grow. They have created ritual and ceremony around it, where there is a special, they call it dieta or diet. So you're prepared, going in, right, because you've changed how you've eaten, and then also. There is kind of like let's call it like a cultural norming that can happen,
Yeah.
so in those communities, in those cultures, the curanderos, or the facilitators of the medicine, like they have come up in a tradition in terms of apprenticing, and also like being trained from early in how to facilitate it, right? So and we're pulling from their culture, from their, knowledge base. And so I think one, because equity and is very important. Like it's super important to acknowledge that. Like this wasn't just, developed by, the folks in the white jackets in
Mhm.
hospitals, right? Like, and in
Yes.
clinics, like we're pulling from those traditions in terms of how we're doing preparation, and sitting with someone under the medicine and integration. And I think it's critical to acknowledge that, right? And
Absolutely.
also, make sure that there's reciprocity as well. Like giving back to that knowledge base in a meaningful way.
Absolutely. Absolutely. How does one find a practitioner like you? How does one find someone like you?
Okay.
And
Well,
how do they find you? How does someone
okay.
find someone like you? And then please give
Mhm.
us your contact information, how they find you, if they want
Sure,
one.
sure. So, there are a couple of directories, right? So there's like I think it's the Psychedelic Support Network, and they have a listing of, you know, licensed professionals that can support, right? And then, if you're looking specifically for me, you can, connect with me through my website for my practice, which is Pure Potential Unlimited. And the web address is just purepotentialunlimited.com. Okay. Now, I am not one to say that anyone that is, maybe working in a different setting as far as maybe what we would consider the underground as a guide or whatever is not as qualified. However, I don't know and cannot say like how to access them. Okay.
Right,
Yeah.
right. But it's good to know that how
Hmm.
to access you and other people who may look like you. And here's the thing,
Hmm.
when there's a will, there's a way. So for people who are looking for
Sure.
spiritual guides, they can probably figure it out the way they figured everything else out, by Googling or
Absolutely.
speaking with people in that community, because it's probably a community of support.
Absolutely. I
Yeah.
mean, there's so many like integration circles, or if you just Googled, like integration circle in my community, you might be able to find somebody who can, maybe just help you, right? Again, you're doing this because you want to, and it is at your, risk or benefit, so to speak. So, yeah, and I will give a plug out to an organization that's in the Baltimore area called the Ancestor Project. And this is a BIPOC organization that whose work in terms of training and supporting people, who choose the medicine is really outstanding in my opinion. I've, had an opportunity to participate in some of their workshops that they've offered, and the individuals facilitating that work are really outstanding. And, they don't come with all the credentials that some of us do, but they come with a
Yeah.
knowledge base that is just as, I think, credible. So,
Yeah. Awesome. Awesome. I want to thank you. This has been so informative. As you were talking,
yeah.
my mind was just uploading about, wow, this would be great for grief. This would be great for people
Oh
who
my
experience
goodness. Yes.
racial
Yeah.
trauma. Grief, definitely.
Yeah. Grief, end of life and dying, right? Say someone may have received a a diagnosis of terminal cancer and really want some support in being able to accept this and, maybe view the end of life in a way that allows them a little less grief, a little less fear,
Yeah.
right?
Yeah.
There's so much work out there about that. And there are several, um, clinical trials that individuals might, look forward to be able to participate in that. So,
Absolutely. Because grief hurts. And as you were talking, I was like, wow, there are so many people who escape grief, who don't want to feel
yeah,
it, or who don't think about it. But
yeah,
whatever you don't think about doesn't go away. It stays in the body, it stays with you. But
so
this
true.
would be an amazing opportunity for people to sit with it, and it doesn't have to hurt because there's that disconnection from it. And I can
That's
see how
right.
this would work really well. Grief, sexual trauma, racial trauma, all type of traumas. That,
Yes.
yeah,
Yeah,
awesome, awesome. This,
absolutely. I mean, there are trials right now where, it's being looked at for eating. Well, certain medicines are being looked at for eating disorders. And, just I think where we may see a lot more movement is when it comes down to PTSD in the veteran community, right?
mm,
That's hopeful in a lot of ways because we care about our veterans and the experiences that they've had, and we want to make sure that they have every access and entry point into this. And um, yeah, so the experiences that they've had, I think if it's led to PTSD, some of these medicines can be super supportive in helping them to heal.
Absolutely. Oh, I can imagine that because I know that I see veterans, and sometimes what they'll say is, I can't unsee what I've seen.
Yeah.
They've got movies in their head, and sometimes they resort to doing things such as using drugs or finding other exits
Hmm.
because just the flashbacks are
Yeah.
so terrifying. So I can imagine if you took this, how it would allow you to deal with those flashbacks so that you can reprocess them and they don't have to
Yeah.
impact you. So this is a wonderful treatment modality. I need to learn more about it, but
Yeah.
been a great talk. For
Yeah.
those of you who want to reach out to this young lady, Melodye Watson, what's your email again or website called again? So we can.
So it is purepotentialunlimited.com.
So,
And there's just a contact form on there. That's my preferred way to connect with people who are interested. I think again, it's still emerging. I know a lot of people have maybe read books. There's the How to Change Your Mind by Michael Pollan. They've seen
mhm,
the Netflix documentary, and
mhm.
may even know people who have tried it. And I think, as many opportunities as we have to talk about it in a way that, doesn't bring up fear, because, in certain communities, when you're talking about, like, yeah, like I'm using LSD to help myself, and, like, you're going to get a wild look. You're going to,
Yeah,
maybe have, concerns, right? Like, wait a minute, this is an illegal substance still. And, our community, is traumatized by the war on drugs. And so we're not like, always kind of
yeah,
apt to be like, yeah, let me try it, So I think, I appreciate you for having this space
oh,
to
yeah,
talk about it. I mean, we just scratched the surface,
yeah, yeah.
right?
But it's a good scratch, and it really is uncoupling, right? Because if this is one of the things that they did to introduce modern medicine, because people will demonize natural medicine and then push something that's westernized, that's
Hmm.
not good for you or your liver, or in our community. But
Hmm.
this is a natural medicine. What I do like is that marijuana has been no longer demonized, no longer a negative thing, that it has medicinal purposes. So I think that has opened the door for people to look
Yeah.
again at LSD and really looking at it as a something that could help. And
Yeah.
I want to say thank you for coming and having this conversation. I hope all of you got something out of it. Please like, subscribe, and share this video. I am Candice Richardson Dickens, the owner of Color Trauma and Healing. I got my t-shirt on, which is a provider directory for BIPOC individuals. I'm also the host of Dope Black Therapist on the YouTube channel. So please go on YouTube, like, subscribe, and share. And thank you again, Ms. Watson, for spending time with us. This has been
Yeah.
amazing.
Thank you so much for inviting me, Candace. I really enjoyed it, and I enjoy any and every opportunity to talk about psychedelics. Maybe,
Yeah.
if you're more interested, like, there's a really great conference this summer out in Denver called the Psychedelic Science, and there are going to be so many like presenters there and opportunities for training. For those that are interested, if you are able, I encourage checking that out.
Awesome. I might be there. I'm
Mm,
curious.
Yeah,
I'm certainly curious. Just this little
yeah.
scratch, I want to know a little bit more. Thank you so much. Good night, everyone.
Thanks.